everyone. I think we'll just wait a few minutes for people to start joining. We've just come on, so we'll give it a minute. There we go, so we've got people starting to join. Hi everyone, so welcome to our live. Today's focus is on inflammation. So my name's Dimple, I'm one of the pharmacists here at the Naked Pharmacy, and I've got Charlotte, who's my fellow pharmacist, an expert in sort of the supplement industry as well. And we're here to answer any questions that you guys might have, or to do with inflammation. So please do start putting your questions through, and we will start answering them. We've had quite a few submitted already, so we'll definitely keep it interesting. So it's open to sort of everyone. Hopefully you can all hear us, so just give us a thumbs up and let us know that the sound is okay and the audio is okay on your end. So from my perspective, inflammation is such a big topic and it covers so many different areas. And I think that sometimes people don't understand actually inflammation, or at least acute short-term inflammation, is our body's natural defense. So it's a part of our immune response to when you're sort of faced with an infection or a cut or something like that. But it's actually when this inflammation persists and turns into something like chronic inflammation that can cause a lot of the problems. I know you've written quite an in-depth blog about this quite recently, haven't you?
Yeah, definitely. A lot about how chronic inflammation is becoming one of the biggest risk factors for us, and the World Health Organization as well have put chronic inflammation and the conditions that are associated with it, like diabetes, cardiovascular disease, arthritis as well, there's many of them, can actually be one of the biggest risk factors for death, which is something that we
overlook it a little bit, because actually we think inflammation is so common, but actually when it is going on for so long, it has such a massive impact on our body. And I think things like obesity and heart disease are sort of those risk factors that come. So it's not just the short-term pain and discomfort that you might experience, but yeah, it can have an impact on things like our stress levels, our heart disease, type 2 diabetes, I think is the other one that you mentioned, isn't it? So if you can keep that controlled, it can definitely have a bigger impact on sort of your general health, I think. But one of the common questions and the focus on sort of inflammation that we tend to get a lot of questions about through our free pharmacist advice service is actually looking at arthritis, so whether that's osteoarthritis or rheumatoid arthritis as well. And just a bit of breakdown, so osteoarthritis is normally caused by sort of repetitive strain on a particular joint area, whereas rheumatoid arthritis is an autoimmune condition, and essentially it's your immune response to sort of attacking itself. But actually both the common symptoms is inflammation around the joints. And so something like turmeric is definitely that beneficial as a natural supplement that can definitely help bring down that inflammation.
Definitely. And then with arthritis as well, like you were mentioning, if we can bring down that inflammation, which is often the root cause of why we're feeling so much discomfort from the arthritis as well, it can then alleviate that pain, give us a bit more mobility as well. If our mobility is reduced, we might not want to have the active lifestyle that keeps us healthy as well. So making sure that's at bay, reducing the swelling can always be a good thing for longevity.
Yeah, absolutely. And often because you get that stiffness when it comes to the arthritis, it almost limits your exercise as well, doesn't it? And then that almost makes that pain and that inflammation a lot worse. So it's almost targeting it, and it can be used, so the turmeric can be used as a treatment, but also preventative as well. So if you're starting to get that niggly pain, so whether it's because of arthritis or because it's, because you've been particularly active and you've hurt a joint and it's inflamed, you can keep on top of it and sort of manage that inflammation that way. So I've just seen a question come through. It says, I've got Helen say, I take metabolic gold and your turmeric, and you've been prescribed medication for high blood pressure. And that's absolutely fine. You can continue with both metabolic gold and the Natraflex turmeric with your blood pressure medication. Brilliant. And so I guess with our turmeric, we do tend to get another question is, there's so many turmeric supplements on the market. What really sets us apart from everything else out there? And I guess I'll let you answer that one.
Yeah, so our turmeric has all 7 of the curcuminoids. So curcumin is the active ingredient in turmeric that is used to help reduce inflammation. But there's lots of different curcuminoids, so having all of them helps us actually attack inflammation at different angles. So that really does help. And then we do need some black pepper in there as well to be able to activate that turmeric and allow us to absorb it and make it effective in our body as well. So we do have our pepperin, which is black pepper. But then another bit that we have is magnesium. So magnesium is always good for muscle and nerve function as well. Yeah. So adding that in adds that additional anti-inflammatory top up as well to the formulation.
Yeah, and it helps support our joints and nerves, doesn't it? And the other thing actually to mention with the black pepper is the piperine that you mentioned. That helps increase that absorption. So actually it's 2000% that increases the absorption of the turmeric. So on its own it's quite poorly absorbed.
It is, yeah.
So taking turmeric supplement without, when it's not combined with the piperine specifically, you can be taking that turmeric, but you're not going to be getting any of the benefits, unfortunately. So it's important that you're looking at supplements that have really done that sort of the research around how they work, not only how they work and the compounds that exist in nature to help with the inflammation, but actually that your body is able to absorb it and utilize it to have that anti-inflammatory impact on our body. And then the other thing is that it's all in a tapioca capsule, so it's all natural and there's nothing else in there that's synthetic or artificial. And often you'll find a lot of supplements out there are packed in with what we call sort of additives, bulking agents, flavourings and things like that, and actually that will just sort of harm almost the absorption that your body's getting. So we focus on sort of our pure supplements where we can. And I think there's a lot out there in terms of like turmeric shots. People sort of recommend turmeric lattes, tablets as well. So tablets are actually full of lots of additives, you need a lot of excipients to make that sort of tablet formulation. So often you'll have a lot of additives in there, exactly. And I guess with turmeric shots, it's not always cost effective because actually you're only getting one shot, which is one dose, but also whether you're getting that full dose that's been scientifically backed to be effective is sort of still questionable, isn't it? Because often you'll get, it's got 600 milligrams of turmeric, but that doesn't tell you anything about how effective it's going to be as a supplement. You really want to focus on what we call the bioactive. So for turmeric, it's the curcuminoids that you mentioned. So I think that's really key. So there's definitely lots of things you can do, and with dose as well, we tend to get a lot of questions for that, don't we?
Definitely, and also the strength of it as well. So I'll show you the back of our labels just so you can see, because it's always good to always look at packets, the back of packets, because you don't know what's in them. So knowing exactly what's in them is always very useful. So I'll show you guys what's in there, bring it a bit closer just so you can see as well. You can see our dosages and the amount and the everything that's in there. There's no extra additives in there with the ingredients. And then also at the bottom, you can see obviously it's vegan, gluten-free friendly as well.
Yeah, and even our packaging is home compostable as well, so that's definitely our ethos there. And obviously you've got our turmeric supplements that can definitely help in terms of managing inflammation, but there's lots you can do in sort of your lifestyle and your diet as well, isn't there? So in terms of, there's a lot of foods out there that can actually increase inflammation. That's something you talk about quite recently in the blog.
Definitely. Something that's been a buzzword going around, ultra processed foods. They're very pro-inflammatory, so it's anything really processed, packaged, because they are using additives to be able to make sure that food can last longer. Making sure that we can have a diet that's got more whole foods in there, more natural and from a good source as well does help, just because it's a bit more natural, pesticides, etc. So things like berries, packed full of antioxidants, polyphenols as well. We want to be eating the rainbow, so all different colours.
Yeah, I think that's key, because often you end up with like beige foods and sort of brown foods, and actually you're not sort of getting everything that you need from that, and that can actually increase your inflammation, isn't it? Like carbohydrates, for example, the white bread, white pasta is definitely things to avoid.
Yeah, definitely.
Your fruits and vegetables are great for sort of helping with sort of minimising that inflammation. I think the other one that comes up a lot is like caffeine and alcohol as well. Oh yes,
definitely. Caffeine and alcohol is always one that is a catch-22, because in the blog as well, I do mention about, is coffee inflammatory as well, because it's a big thing. There is evidence that it is inflammatory, there's evidence that it isn't inflammatory, and the main thing really is it is an individual choice and an individual reaction. Is your caffeine tolerance good? Can you tolerate coffee? Can you not? And then also, it does have some benefits from the coffee grain itself, in the sense that it has lots of polyphenols and antioxidants in there. However, we've got to look at what we add to the coffee sometimes.
lots of sugar, unfortunately, sometimes.
Black coffee on its own doesn't really taste amazing for people that don't like to drink it, or if you're used to drinking it with milk and sugar or creams or anything like that. Having black coffee on its own can taste a bit bitter. But bitter foods are actually very good for us. To be honest, so
it's always the things that don't taste very good that aren't the best for you, isn't it?
Definitely.
But it's everything in moderation, I think. And if you are someone that's prone to inflammation, or you are suffering with a certain condition that does trigger it, then it's almost like doing that sort of research and looking at your diet and seeing actually, have you got a high caffeine intake? Are you drinking excessive amounts of alcohol? Is your diet varied? So are you getting sort of the whole foods, or actually are you having foods that are quite high in added sugars, or drinks in high in added sugars? And actually look at incorporating, like Charlotte said, sort of that the foods of the rainbow, so all berries, fruits, nuts. Oily fish is quite good, so fatty fish like the salmon is quite good.
Definitely.
In terms of anti-inflammatory, so there's things that you can do, and we are available. So if you want sort of that one-to-one advice and want to sort of talk through what we can do, we run a free pharmacist advice service, and that's with inflammation or any other conditions that you want advice on. So you can give us a call. And actually, before I forget, we are running a discount code alongside this live today. So Let's Talk 20 will get you 20% off our turmeric supplements and our gut love supplements as well. So definitely make the most of that. And just looking at the questions, I've got the iPad here. So what are your thoughts on people saying taking multivitamin can reduce your lifespan? So I think I'm a bit with multivitamins. Often they are manufactured synthetically, so they're packed full of lots of synthetic nutrients, so whether that's vitamins or minerals, and these are processed in a lab and often full of chemicals, and that manufacturing process involves chemicals, and often the starting point is something like genetically modified corn. So actually, for me, I would look at supplements that come from natural sources, that come from nature, and because you're getting the full nutrient profile that is available in nature. So it's not only that nutrient. So for example, like magnesium, for example, we get ours from seawater, but you're not just getting magnesium on its own. You're getting a range of nutrients that help improve the absorption, that is actually quite gentle on the stomach. And actually very well absorbed by the body, because often synthetic multivitamins, you think you're getting all of these nutrients into your body, but actually how much of that are you truly absorbing? So it seems like they might be a cheaper alternative, but actually it might be wasteful in the sense that it's kind of just passing through you and you're not getting the benefits out of it. And I think the other thing is they are normally quite high, so some of the vitamins in there or minerals are quite in high quantities, because when they're manufactured in this process under sort of mass manufacturing and under chemical processes, you can normally pack a lot more into there because they're just normal small white powders. But actually, does your body really need those high quantities, or is it being more harmful to your health? So I would focus on looking at you as an individual and looking at actually, are there specific nutrients that you should be avoiding, or actually are there specific nutrients that your body needs? So it's not a one size fits all, and I think that's where our service can come in, so we can sort of discuss that with you. So actually, are you lacking in energy, or is your sleep quite poor, or are you going through sort of hormonal changes that you want support in? So I would look at you as an individual, as opposed to just take one capsule that does it all, because often it doesn't really do it all, unfortunately. And I'd look at the science and the data behind all the supplements that you're taking, and also actually, do you want to be putting in those additives and chemicals into your body? And often they can do more harm than good, especially as they accumulate over a longer period of time. I don't know if that's sort of your standing on the multivitamins as well.
There's obviously a difference between certain vitamins and minerals. Some are water soluble, so if some of them are water soluble, those aren't going to stay in our system. Anything that we don't need, we'll excrete. So I think probably the reason why it might say that we shorten lifespan is because we're putting our kidneys, our liver, all of their metabolism and excretion goes through them. So if we had taken really high dose multivitamin like that, it could be just causing more stress on them. And I think you've sort of added to that, even an expensive brand. So often it's more looking at the quality of the ingredients, and not necessarily just looking at price. And a multivitamin, it's actually what it goes into it. So look at the list of ingredients, as Charlotte mentioned, look at the bag, look at the ingredients list.
what are the source of that of that nutrient. So for example, vitamin C, if it's labelled as ascorbic acid, you know it's been synthetically manufactured. But actually, if it says vitamin C from, for example, in ours we get it from amla berry, is that where it's coming from? So that's much better for you, and you're going to benefit from a natural source much more successfully than something that's synthetic. And it's a personal choice, you know, you're looking at your health. If that was on your plate, what would you choose? That white powder that's been made in a chemical lab, or would you choose that you know, that juicy amla berry? And that's really a rich sort of natural rich source of vitamin C. So it's often looking at actually what your priorities are with health and targeting them on an individual basis. I think we've had quite a few other questions come in, so we'll just have a look at them. So thank you for submitting these, and if we can't get through to all of them, please do drop us an email or give us a call. We're available today until 5 p.m. and then every day of the week as well. And then you can also drop a comment on the saved video at the end as well. So if we do miss anything, you can reach out to us. So one of the questions we've got is, what vitamins are best for inflammation? So I think I'll let you take that. I think we've sort of touched upon that already.
Touched a bit on that. I think with turmeric as well, and also with an anti-inflammatory diet with food as well. And there's omega-3s. There's also another one to look into. That's why we'd say oily fatty fish like salmon would be a good option, because they are high in omega-3, and omega-3 is very good for reducing inflammation within the body, and just keeps everything supple really, and moving. So that would be a good option, I would say, for vitamins and minerals in our lifestyle in general.
Yeah, and then obviously we've got the Naturaflex turmeric that can help, just because of the curcuminoids that are anti-inflammatory, and that will help if you're looking for help in that area. And actually, one thing we've not mentioned is actually we can use it as a preventative. So if you're quite active, if you're a runner, or if you're quite sort of, you do a lot of exercise, we speak to a lot of people who actually take it in anticipation of actually having sore muscles or being a bit run down, and actually you can take it sort of a few days before, the night before, and almost use it as a preventative. And I think the other thing I like about the turmeric is it's a lot more gentle on the stomach. It's suitable for people who maybe ibuprofen or other non-steroidal anti-inflammatories aren't suitable for people like asthmatics as well. And it's something to have in your cupboard. So I have it almost, so I've got family members who take it regularly, and then I've also got it in the cupboard as more of a just in case. So if you did need it as a sort of a short-term response, you can use it in that way. So it's almost a natural alternative to ibuprofen, as well as something that you can take sort of on a regular basis. So it's quite versatile in terms of its use. Definitely. And also the dose as well. I think it's really down to yourself. So it's 1 or 2 a day. And often I say to a lot of my customers, actually, if you've got some pain or inflammation that you want to get under control, then start with 2 capsules a day. And actually, once you've found that's under control, you can try and reduce that dose down as a maintenance to 1 capsule a day, and you might find that works. And then you've got the flexibility to increase that back up to 2 capsules a day if you have a flare-up or something triggers your symptoms. So again, you know, there's so much you can do with it, and it can work to suit you and your needs as well.
Definitely.
So this is a good question we've had submitted. So is it possible to reverse damage to arthritic knees?
Well, it's not. I would say you can help reduce the inflammation and help manage the pain within the arthritic joint, that's for sure. Arthritis is going to cause a lot of inflammation, and that's causing swelling. So we can reduce the inflammation, reduce the swelling, that can help with the pain and help manage how you're feeling with your arthritis.
Yeah, and I think it's the idea of slowing that progression down, isn't it?
Definitely.
And a lot of the time, it's if you can get your symptoms under control, you'll feel a lot better in terms of the pain that you're experiencing, but it's that movement that you get back, isn't it? And that flexibility, because a lot of the time you can get that stiffness. So if it's in your fingers, for example, a lot of people I speak to, they almost after a couple of days of taking Naturaflex turmeric notice that actually their movement is returning, and that helps with their mobility, and actually that in turn helps manage your symptoms a lot better as well.
Definitely.
And actually that leads us nicely onto the next question: is it possible to improve the range of movement in arthritic knees? So yeah, absolutely. So if you can get that inflammation, which is what is causing that tightness, if you can reduce that, then you can have the scope to increase your movement in the affected joint. I suddenly got a knobbly finger joint. Is this the beginning of RA? Rheumatoid arthritis, and what can I do about it?
So having a knobbly finger joint could be a few things, to be honest, but if there's a swelling on your actual finger, that could be a sign that there is some form of inflammation there for sure. However, I would say always go get that checked out with your GP just to see. They can do blood tests as well to diagnose rheumatoid arthritis if it is. But if it is, if it isn't, then I would say turmeric would be a good option. Natural would be a good option as well, just to reduce the inflammation and be able to, like Dimple said, be able to move your hands and fingers and mobility gets a bit easier.
Yeah, and I think that's key, isn't it? Because that's what we normally feel. That causes the symptoms, and that's what sort of the inconvenience and really affects your sort of day-to-day activities, I think. So if you can get that under control, that will have the biggest impact. And then one of the other questions is, I have had tendinitis for a few months and nothing seems to help. Could Naturaflex help?
So tendinitis itself is inflammation. It's inflammation of the tendon. So many conditions ending in itis are a form of inflammation. So yes, I would say Naturaflex would be a good option to help reduce that inflammation and make you feel a bit more pain, more comfort, not discomfort, to be able to heal that up, because we need to bring that down. It's been a few months now, and we've now entered the possible chronic side of inflammation rather than the acute, trying to help it heal. So it might need a little helping hand and support to be able to get there.
Yeah, absolutely. And I think that goes across. So we tend to get a lot of questions, and we were talking about this plantar fasciitis is another common one. So it's normally anything that ends in itis is that inflammation. And so turmeric can help with a lot of these conditions, because as it says on the tin, helps to bring down the inflammation, because that's what's causing the symptoms in a lot of the time. And most of the time, your GP or the advice that you'll get is to take something like ibuprofen. But it's just something that doesn't always suit everyone. Often it's better short-term use. And actually, we do find that actually when you're prescribed ibuprofen or another NSAID for a long period of time, you normally then get prescribed a proton pump inhibitor to protect your stomach. So something like omeprazole or lansoprazole, because ibuprofen can obviously upset your stomach so much. So something like Naturaflex turmeric is such a natural alternative that's very gentle on the stomach, supports gut health as opposed to harms it, and actually doesn't require you to then have to take another medication to manage the symptoms caused by the initial medication, and it can sort of spiral, can't it? So I think it's worth trying, and actually if you want to take it alongside ibuprofen, you can. So it's sort of flexible in terms of the way you take it. What is different about Naturaflex compared to other turmeric supplements? So I think we touched upon that in terms of sort of what goes into it. So the fact that it's backed by science, so we include all the curcuminoids in there, that are the compounds that exist in nature that cause the anti-inflammatory effects within the body. It's got no synthetics in there. We've added in the piperine to help with the absorption by about 2,000%. It's got the natural magnesium in there, and then the natural capsule shell as well. And I think that sets it apart. So I speak to a lot of customers where actually they've tried other supplements out there or other turmeric supplements that have sort of been, claimed to be effective, and they've not found it's done much for their health. But actually, a few days on the Naturaflex turmeric, they've seen a substantial decline in their symptoms. And I think that has kind of says it all, because for us as pharmacists, we formulate based on science, and we sort of test each batch to make sure that it's got the right doses in there, which is unfortunately not something that's regulated across the supplement industry. So it's not something that unfortunately everyone has to do, but we choose to do that because we want to bring across those the most effective science-backed supplements for you that are shown to work, and that's really important for us, that we're giving you advice, and the supplements that we provide are proven.
Yeah, definitely.
And then, can it be taken alongside other medications?
It can be taken alongside other medications, definitely. As Dimple said, you might want to use it alongside your ibuprofens and things like that to help increase pain relief even more. However, there is one class of medications that we would say to be careful, and you can always talk to us about it, but most of the time we would not recommend. That would be anything like blood thinning medication. So this could be something like warfarin, apixaban, any antiplatelets as well, something like aspirin or clopidogrel. So if you think that you're on a medication but you don't know if it's a blood thinner, we're always here, and we're happy for you to call us, drop us an email and ask. We'd be more than happy for you to do that, and we can answer that for you.
Yeah, brilliant. And actually this one's quite a good one. So can turmeric help with inflammation caused by exercise, specifically running?
As a runner myself,
yes.
I thought I will answer this one. Yes, it can, and it is a very good option, I would say, for people. I personally take it myself, as you might know from newsletters as well. So I do, similar to what Dimple said, I take one before. I do feel like I'm going to do something very strenuous, like a long run, because running is really high impact, and people that do run probably know their knees hurt. So making sure that I'm trying to help prevent that so I don't get an injury and then I'm put out of training or going out for a run just for fun. I then have the turmeric before, and then also have another one afterwards, so after I have my run, just to make sure that I'm protecting myself and reducing that inflammation as much as possible. So for high impact exercise like running, definitely, but any form of exercise really.
Yeah, we're talking about weight, sort of high intensity, sort of weight lifting, that sort of thing is quite beneficial for as well.
Those micro tears that are going on for our body to adapt and get stronger, they cause inflammation. So just allowing that to happen, but if you get very, very sore for a prolonged period of time, or it, like I said, puts you out of training or stops you from doing something you enjoy, then I would say it's very good.
It's a balance,
to top up with.
Yeah, it allows, I think, sort of endurance as well and recovery. So it's preventative treatment and actually a recovery.
Yeah.
So it's sort of different sort of aspects and sort of ways it can work. And I think probably got time for one more question. So actually, can it help with gut health and help with symptoms of IBS? And I think this is definitely another key area. And turmeric is great for helping with inflammation anywhere in the body, and the gut is sort of also included in that. And the other thing that's also good for is gut love, which really helps with inflammation within the gut, specifically for people who might suffer with conditions like IBS, symptoms, or sort of discomfort within the gut. So absolutely, so you've got either the turmeric or the gut love, and you can actually take them together for different reasons. So the gut love helps to really restore the gut microbiome. So it's all the good healthy bacteria in the gut that is beneficial to you, that can be damaged through stress, medications,
like NSAIDs.
Exercise, absolutely, so NSAIDs, and even sort of lansoprazole. And I think we'll talk about sort of nutrient absorption is sort of impacted when you're taking these medications as well. So absolutely. So a combination of the two, or actually depending on what your needs are, you can always speak to us and we can advise you. And just to sort of reiterate, we've got that code on, so it's Let's Talk. Let's Talk 20, and that gives you 20% off the turmeric and the gut love. And that will hopefully sort of add a bit of saving to you. I've got a question come through. Will it help with fibromyalgia?
So fibromyalgia as well is something that I would say probably will help make you feel more comfortable, reduce the systemic inflammation, because it's more likely to be something that's occurring throughout the whole body, not localized like a joint, etc. So it would be definitely something to try to help increase your mobility, and can help with the fatigue side of things as well. Because fibromyalgia, it might go hand in hand with chronic fatigue and things like that. So helping with that is a really good option, and the magnesium in there also helps boost that.
Absolutely helps with nerve and muscle health. So magnesium is great for fibromyalgia. So it's included in the turmeric, or we also do our marine magnesium separately. So that would be great. I think that's all we've got time for today. Sorry if we've missed any questions, or if you have any questions that you wanted to reach out to us, give us a call, drop us an email, or leave a comment below, and we'll come back to you and make the most of that Let's Talk 20 code as well. It's been great. If you've got any other topics that you want us to cover, any other questions come through, do get in touch, and we'll try and focus on that next time. Thank you so much.
Thank you. Take care, guys.